Let's go over scar mobility. So if I have a scar right here, and if this scar is tight, we'll kind of squeeze it to make it tight, and I try to lift my arm, I can only lift it about this far before it pulls hard on that scar. So if your scar is tight, you want to check its mobility and learn how to improve the mobility of the scar. So you can put your hand right over the scar and bring it up, down, left, and right, or any of the diagonals, and feel which direction does it not move as good as the other side. So say it's not moving good upward, I would just put my hand over that scar and pull the skin upward and just hold that tension and hold that stretch on there for a good 30 seconds. Okay? So you want to go the whole length of the scar and assess it for mobility. Make sure there's no adhesions, which is kind of like scar tissue build up and kind of adhering to the other tissue underneath, to the bone, to the ribs, to the muscle, to any of the fascia. So you want it nice and flexible. So that's a way that you can work on your scar. There's also a thing that sometimes shows up. It's called axillary web syndrome or cording. And what that is it looks like a tendon or a guitar string that just kind of pops up in the armpit or in the bend of the elbow or even down in the wrist. So you might be fine, and then all of a sudden you'll be like, what is that, and why is it pulling and tight right there? So if you say you notice some, it's called cording. If you notice some cording in the elbow, you would put one hand below the elbow and one hand above, and you would just gently stretch on that until it releases or relaxes. So you could stretch on it for a good 30 seconds. And a lot of times I'll change my angle and kind of pull at a diagonal or pull straight or the other diagonal, and basically trying to release it or break that adhesion right there. So cording, they think, is a lymph vessel that is just inflamed and irritated, and it usually takes at least a month for it to kind of calm down, but this is a way that you can kind of treat it ahead of time and help improve your range of motion and make it feel better.